of the appropriate size. This is placed over the upper arm. Palpate the brachial pulse and apply gel with the probe at the site where the pulse is felt. Place the Doppler probe lightly on the gel at a 60-degree angle towards the patient's head. Inflate the cuff rapidly until the brachial artery flow ceases, no further Doppler signal, and continue for about 20 to 30 millimeters of mercury above this value. Following this, deflate the blood pressure cuff slowly at 2 to 4 millimeters of mercury per second in order to note the systolic value. You can then wipe the gel from the patient's skin and repeat the procedure on the other arm. Following measurement of the systolic blood pressure in the upper extremities, measure the systolic blood pressure in the lower extremities. First, place the cuff above the ankle. The dorsalis pedis artery is located initially by palpation or identified by Doppler alone if no pulse is felt. You should obtain an arterial Doppler signal, which can be monophasic, biphasic, or triphasic. Apply the Doppler probe to this area and inflate the blood pressure cuff to 20 to 30 millimeters of mercury above the level of flow cessation. Then slowly deflate the cuff until you hear the sound of the systolic pressure and record it. Repeat the procedure for the posterior tibial artery. Once you have completed the measurement, remove the cuff and place it over the contralateral leg. Repeat the procedure for the contralateral dorsalis pedis and posterior tibial arteries. Calculate the ankle brachial index. Divide the systolic blood pressure from the ankle by the systolic blood pressure from the arm. Use the higher systolic pressure from the dorsalis pedis or posterior tibial artery for the calculation of the ankle blood pressure. Also, use the higher brachial systolic pressure as a lower arm blood pressure may be due to arterial occlusive disease in one of the upper extremities. Normal ankle brachial index at rest ranges from 0.91 to 1.3. Above 1.3, you should suspect that the patient has incompressible vessels. Decreases in the ankle brachial index are consistent with peripheral arterial disease. Mild to moderate peripheral arterial disease usually produces an ankle brachial index in the range of 0.41 to 0.9. Below 0.4, severe peripheral arterial disease is usually present.